This is 13 ABC Action News at 4 with Tina Williams and Tony Gettis.
Turning to some news in the COVID-19 pandemic, new cases are declining or stable in all 50 states.
As COVID-19 cases drop, we're seeing some pandemic rules start to pull back. COVID-19 changes are our big story today.
This comes as hospitalizations are down nearly 50%, with new cases dropping 61% since mid-January. Nearly 632,000 kids tested positive last week.
Some states are also dropping mask mandates for school districts. Here in Ohio, there are no mandates in place, but we do have some school districts that are still requiring masks. We have the Lucas County Health Commissioner, Dr. Eric Skaczynski, with us. It's a real hot button issue. So what do you think? Should we still be wearing masks?
You know, it's been a hot button issue for many months. And, you know, it's up to the school districts whether they want to continue the mask use or not. Many of the schools have already decided that, you know, the mandatory mask use is not being done. You know, from my perspective, again, it does go back to their choice.
Okay. Now, somebody like TPS, that district has never wavered from its mask mandate. So do you see a benefit to that by just kind of staying the course?
Well, you know, we can delve up the research. You know, I just read some research here recently that perhaps, you know, certain masks don't work. And, you know, we're not going to know the exact data and the research for, you know, months to years to come on what works and what doesn't. Right now, I support TPS. I support any school that wants to go ahead and continue their mask use. You know, there is some protection. But at what level and what mask are they using as well, too?
Sure. That becomes a big issue, whether or not you're wearing it properly. In the past few weeks, we've heard that it's better to use the hospital grade masks or the KN95s. And then those ones specifically need to be fitted to your face. You can't just throw it on.
Correct. That is correct. And you know, that is the concern with, you know, some of the mask use. The cloth masks are really easy. The surgical masks are just about as easy. But then you get into those, we'll call them the more advanced masks, the ones that we know really filter out a lot of the particulates. You have to get them fit tested, and they have to fit your face brace. You have to know how to put them on and take them off. So they're a little bit more complex.
Now, with COVID cases dropping really dramatically and seeing some of those clinics closing and schools shift and businesses, how close do you think we are to an endemic status right here in Lucas County?
You know, again, the endemic status means really simplistic that it's here, that, you know, we're experiencing it. It's in the environment. You know, I think talking with some of my peers, we already consider that it's endemic. You know, we're waiting for that final definitive answer from, again, those researchers. You know, the dropping cases, I think we all should be very helpful in what we're seeing. I just looked at the cases today. You know, over the last day or two, 45 new infections, where a month ago we had 1,300. So you definitely see, let's just say, the bottom falling out of our COVID cases. So let's hope that continues and stays that way.
And finally for you, Eric, is there any concern? I know that we've heard about some other rumblings of variants, but at this point, there are no cause for concern. Any indication that, you know, we could possibly see this happen again? We kind of rode this wave once before.
You know, a couple things. Not hearing any real significant chatter about new variants, but let's be assured that there will be a variant coming eventually, whether it's tomorrow or next week or next month. Something else will pop its head up. You know, really, too, the idea here is we're just going to have to live with the virus and do the things we need to protect ourselves and our family, which, again, you know, I think eventually we're going to look at this more as along the common cold or flu than what we've seen over the last 2 years.
All right. Well, thanks so much for being with us this afternoon, Eric.
The CDC is still recommending mask wearing in schools, but 4 states plan to drop mask mandates for schools in the coming weeks. As cases decrease, some doctors say it could be the right move, while others are not sold.
Because infection numbers are coming down, I think it's pretty reasonable to pull back on those mandates.
We're going to see school-based outbreaks at a time when we're trying to return to normal, but we're actively making decisions that go against that.
COVID-19 cases among children are way down, but still double what they were during last year's Delta surge. 27 million eligible children are not vaccinated. Well, the Ambassador Bridge in Detroit back open today after it was shut down yesterday for hours due to this. It's part of the convoy of trucks from Canada protesting the country's COVID-19 restrictions. The bridge, as you know, a major route for commercial trucks. The protest started about 10 days ago in Ottawa, with truckers calling themselves the Freedom Convoy. They're against Canada's recent COVID-19 mandate, which requires drivers entering Canada to be fully vaccinated or face testing and quarantine requirements. The weeks-long protest has made news in Canada before spilling into the U.S. yesterday.
Public health officials have warned for months millions of Americans remain at high risk of severe illness, possibly death from COVID-19.
And for those who are especially vulnerable to severe COVID, providers say you need to act quickly. There are some ways to curb the risk of hospitalization. And the FDA has cleared 3 different treatments for immunocompromised patients: the antiviral drug remdesivir, monoclonal antibody treatments, and an antiviral pill like Paxlovid and molnupiravir.
The drop in cases has allowed local healthcare facilities to build up their supplies of a life-saving COVID treatment for some patients.
Yeah, we're talking about the monoclonal antibodies, and 13 ABC's Melissa Veitch is live with the details. Mel?
Well, Tina and Tony, we were completely out of monoclonal antibodies just a few weeks ago. It was very concerning because that came at the height of our Omicron surge here in Toledo and Northwest Ohio and really throughout the state. The entire state was out. Now we are starting to see those supplies replenished just a little bit. It's still in short supply, but all told, there are 3 different treatments that are monoclonal antibodies, but 2 of them don't work against Omicron. So it's very important that we're seeing at least some treatments available for the Omicron treatment.
Right now, the only one that is showing a significant efficacy on the Omicron variant is sotrovimab, and that we have limited supplies, both in Ohio and Michigan. This is a national shortage. We're not certain when that supply will increase, so therefore we put some restrictions on who we will prescribe that for.
So at this point, at least the reports are that we will see that supply in greater numbers probably by the spring. But like all of the things with COVID, whether it's PPE or any of the things that are associated with treatment and protection against COVID, they have to make it first. Tina and Tony?
All right, thanks so much, Mel. Well, from there, another thing that is impacted when it comes to COVID-19 is restrictions. Even though cases are dropping here in the U.S., the CDC is expanding its warning for travelers that might be planning international trips. Here's a map. This actually shows more than 130 countries the CDC is flagging as spots of concern for COVID. Those are shown in red. And there's some new developments here. There were 7 new countries just added to that travel list. You see them here: Armenia, Cuba, the Democratic Republic of Congo, Israel, Japan, Libya, and Oman. Now, the CDC also ranks all of these countries. You might be wondering, how do we get here? Well, they base it on the COVID case count and risk. Level 4 is the highest risk, and the CDC recommends avoiding travel to the areas if possible, or if you must go, the CDC says make sure that you are vaccinated first. So that is the latest update. Those countries just added to the list.